Hi everybody. I want to today start with the complement system and the relation with COVID-19. And the last lecture I spoke about the pharmacological background and treatment of the COVID-19 in the two main process, how we can prevent entering virus in the cell, how we can prevent this process, and how we can prevent replication and gene expression and the prevention of the proliferation of the virus inside the cell. Today I want to continue with the effect of COVID-19 and the complement system. As you may remember, there is three types of the complement system mechanism with the classical, lecithin, and the alternative. Okay? If we draw the one coronavirus here, okay, and the complement system, there is three steps: lecithin cascade, and alternative. Okay, and the third one classical. I don't want to speak more about physiological background of this process. As you know, there is a relation between these three, and the main relation between these three is the C3, okay, complement 3. As you know, when the complement 3 protein, C3 protein, can be activated with this 3 cascade protein mechanism, C3 can change to the C3A and the C3B. As you remember, complement system can activate inflammation process also, and it also has opsonization process. Okay, and the other process is also with this mechanism, it can activate the C5. As you remember, again C5 can be called the C5A and C5B. Okay? Okay? And from the C5B we can go C6 to C9, if you remember, and C7, and we can go to the make of the cell lysis, because it can C7, C8, C9, and it can cell lysis, make a hole in the membrane, and it can cell lysis happen inside the cell. And from the other background, we can see 5A, and we can continue the process of the. But one of the mechanisms which is important in this process in this interleukins, because the interleukins can cause, because when the process is active with the COVID-19, when the process is activated with the COVID-19, okay, one of the important things happen in the cell, interleukins increase, because as you know, interleukin 1, 8, as you say, I remember in the last lecture I spoke about interleukin 6 and interleukin 21 and tumor necrosis factor, and the tumor necrosis factor, they will be produced inside the inflammation system, and it can cause cytokine release syndrome and accumulation of the neutrophil and the monocyte and the macrophage. In this mechanism can cause, because of this process, can cause this, and it can cause a cytokine release syndrome, and it can cause increased amount of neutrophil. Okay, it's very important, and the monocyte. Okay, and in the lab test we can see this process. It's very important. For example, I can mention how this is the process goes out. It's very important. And when this process happen, what's happened in the next step? Okay, we can, as you remember from the here, and this complement system will be activated. Now how we can prevent, okay, this process. Okay, the first medicine which is very important for us, okay, is the Narsoplimab. It is the Narsoplimab. It is a medicine can prevent lecithin cascade. Okay? Okay? It is a MAB, It is, as you remember, MOG is from the medicine is the antibody, human monoclonal antibody, which is the target is the lecithin cascade, lectin-associated serine protease 2. It is the MASP2 mechanism. Okay, this prevent this one. It's very easy and very important. Sometimes in the process we can prevent, and we can use also other medicine from the other family of medicine. Excuse me. Other medicine for this cascade, we can use C1 inhibitors. Some drugs have the effect of the C1 inhibitors. Okay, we can block the classical because this one can prevent classical. Then in the production of the C3 is the decreasing. It is very very important because we can produce this one. And the next medicine which is important, we can use AMY 101 group of the medicine for it is a new medicine which can block C3. Okay, in this situation C3 cannot be activated, and the opsonization and the cell lysis process will be stopped because it is very important. And we also use a new drug AFX1 for the blocking the C5A, because this drug also can block the mechanism of the C5A for the opsonization and activation of the immune system. Okay, and as you remember, because C5A is the anaphylactation process and causing increasing of the expression and the adhesion of the molecule on the endoplasm, endothelium, okay, and they can cause contraction of the isthmus muscle and increase vascular permeability. Then situation, immune system can immigrate in the tissue and in the extracellular matrix, and it can cause edema, and it can cause a shock and maybe anaphylaxis process in this situation. Also, we can use other drugs. We use Avdoralimab. It's for also we can use for this one. It can prevent the C5A can bind to its receptor, because this find it needs for the receptor. Okay, if we use Avdoralimab, okay, we can prevent the binding, okay, the binding of this medicine for the receptor, because we can prevent. Avdoralimab is the new drugs for the antibody. It's a therapeutic antibody because it's a MAP group, and it's prevent binding of C5A to its receptor, and it's stopped the activation of the neutrophil with the mechanism with the expressed on the subset of the myeloid-derived suppressor cells, because it's prevent to activation of neutrophil. Then the neutrophil activation increase, and then neutrophil cannot be increased. Okay, and the other drug is the which helps for the C5. It is the Ravulizumab. We can prevent for the prevention of the C5. With these drugs, it is especially it can bind to the terminal component of the C5, and which acts in the late stage of the complement cascade. In this situation, the last stage of the complement cascade can be stopped, and cell lysis and the opsonization will be decreased, and in the process of the inflammation can be controlled. Okay. Now it is very nice, and I spoke about this part. About now, I want to speak about pathophysiological background of the inflammation. How does the inflammation happen? As you remember, with the COVID-19, as you see here, can cause increase of the interleukin. Okay, it is a storm of cytokine. You see, this amount is increased. Storm of the cytokine. Okay, it's very bad. Then in the other step, the COVID-19 also can activation of the coagulation. The first lecture I also mentioned, also COVID-19 can cause activation of the coagulation, activation of coagulation cascade is very important. How with the activation of the D-dimer, it is very important. We know that for the increase, and it also can cause, in the first lecture I mentioned, it can cause a decreased amount of the platelet, and it affect onto in the coagulation cascade. Okay, and for the coagulation, we also, the other mechanism which is important for the coronavirus is the POP2. It is important because in this situation it can activate POP1 and the POP2 and also affect with these two process. Okay, because this also help for the coagulation because impaired neutral anticoagulant pathway, because it's impaired, doesn't work, and then shutdown of the fibrinolysis, because these two mechanisms helps for this process go very fast, because it shut down the fibrinolysis and impaired the neutral anticoagulant pathway. And this situation because of the pro-inflammatory effect of the COVID-19. And it is important. The last step is how this there is a relation between the angiotensinogen and the COVID-19. As you remember, it's very easy and very nice. In the last step, I draw here. As you remember, kidney can produce renin when the blood pressure or blood volume is low. Okay, renin can convert angiotensinogen to the angiotensin 1. Angiotensinogen produced by the liver mainly can convert to the angiotensin 1. Okay, angiotensin 1. Angiotensin 1. Okay, with the AC. Angiotensin converting enzymes, which produced mainly by the lung, can go to the angiotensin 2. Okay? Okay. Now I want from here I see the background. There is a two mechanism. Okay? Okay? Angiotensin 1 with the convert to the angiotensin 2 can affect with the normal ACE receptor. Okay? Which convert because of the ACE convert to the angiotensin 2. Okay? And 3. Okay? Until here, no problem. And this cascade, this can affect in the angiotensin 1 receptor. Okay? And it can cause inflammation process. Okay? Pro-atrophy. It is very important. Can cause pro-atrophy. It can cause pro-atrophy, pro-fibrinolysis, pro-inflammation, pro-oxidant, and cause vasoconstriction and everything. Okay? Then inflammation stops, and it can go to the tissue injury. Okay? But then, in the normal situation, with the help of ACE2, okay, angiotensin 2 and 3 convert to the angiotensin 9 and 7. 1, okay, 1, 9. So you can change to the 1, 9 and 7, if you see. 9 and 7. Okay? And this 7 and 9 affecting the MAS receptor, MAS receptor, and it's the opposite of this process. Okay? Pro-atrophy, it gets anti-atrophy, anti-fibrinolysis, fibrosis, and vasodilation. All is the tissue protection. Now is very important, which I mentioned. This ACE2 receptor can block by the COVID-19. What's happened? AC angiotensin 2 and 3 remain. Angiotensin 2 and 3 remain. And the process of inflammation increases in the patient. No convention. And in this situation, MAS receptor stop because no angiotensin 1,9 and 1,7. In this process, what happened? Tissue protection decrease. The balance is not good. Tissue protection decrease and inflammatory tissue injuries increase can cause the big problem in the whole of the body because of the mechanism, high amount of angiotensin 2 and 0. And other problem is vasoconstriction because of angiotensin can cause high blood pressure. And it is very bad for the patient with the hypertension problems, and the patient with obesity, and the patient with the kidney problem, and with the heart failure. And this whole process can cause tissue injury in the main and can cause organic failure, both organic failure, which is very bad. But sometimes we see the patient because of the activation coagulation cascade in the middle of this stage, for example, no organ failure, not anything, but because of thrombosis, unfortunately, patient dies. What I mentioned in the hospital, mainly for the treatment, we have to care about the inflammation process and the coagulation process. And I mentioned always we have to test in the blood test about the coagulation. How is the about the platelet and activation of it, and because if we know with the blood test we can prevent with the medicine anticoagulant, for example, in the hospital, and we can save the patient life. And it is very important for this system. I hope it was this 4 lecture about COVID-19 was good, but I tried to explain about the COVID-19, and I am a lecturer and I research about pharmacology, and mainly I think how we can help for the patient. I hope I see you in the other lectures, and have a good time. See you next time.